Dr. Humayun, can you speak about the impacts of stigmatization on COVID patients and healthcare workers? In your experience, do people actively seek out help?
Stigma, I think, is a huge barrier for us to move forward. And the stigma is not just for the pandemic, but even before the pandemic, if we look at the cultural context of these countries, psychological issues are generally seen as a sign of weakness. Mental people with mental disorders are looked down upon. And this stigma not just exists in people who are not educated or in low socioeconomic class, but they are also prevalent in health professionals. And you can clearly see the stigma in the health policy and in medical education. In Pakistan, we still do not have a formal exam in psychiatry for a doctor graduating. So a graduating doctor will have to do an exam in eye and ENT, but not in psychiatry. So what has happened after the pandemic is that because of the risk of infection, and I think that I might speak for all of us when I say that the media might not have done justice in raising scientific awareness, at least in the earlier part. And the communities were more relying on myths rather than the scientific information about the pandemic. And as a result, people were very wary of those who were directly in contact with infected personnel. This is especially true for frontline responders. And I have supported a few women doctors and nurses, and I know how difficult it was for them, because particularly for those who were living in joint family setups and had to go back to parents-in-law, and how their job was seen as a direct threat to the elderly people in the family and the pressures that they have sustained to continue their service. Uh, Dia has already mentioned the challenges with burials and funerals, and unless we have culture sensitive policies and practices where people can feel confident in accepting the scientific knowledge and overcoming stigma, I think we will continue to have lots of problems in Pakistan, particularly during the pandemic. An example that comes to my mind of a poor policy and practices, that in urban centers, what the police started doing was that they started putting this big notice outside the houses where a case of infection was detected. And as a result, the whole mohalla or the whole street will go and gossip about that family that they have a case. And the family was like ostracized in some way, not just physically isolated, but ostracized because they have developed this infection. In the same way, there are numerous reports in the media that people who were infected, they would withhold this information from officials because they were afraid of being taken away from their families into quarantine centers.